And amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. Our department videos will be available in the playlist. You can check it. Today, we are going to see about renal function test. A renal panel is a group of tests that may be performed together to evaluate kidney functions. The test measures levels of various substances including several minerals, electrolytes, protein and glucose in the blood to determine the current health of your kidney. Properties and composition of normal urine. Here we can see the volume should be 1000 to 1500 ml per day and the reaction is slightly acidic with pH of 4.5 to 6. Next, specific gravity, osmolarity, color and odor. Composition of urine. Urine consists of water and solids. Solids include inorganic and organic substances. Solids excreted in urine is divided into organic and inorganic substance. In organic substance like urea, uric acid, creatinine, ammonia, and in inorganic substance we can see sodium, potassium, calcium, chloride, phosphate, sulfate. Renal function tests are the group of tests that are performed to assess the functions of kidney. Renal function tests are three types: examination of urine alone, examination of blood alone, and examination of blood and urine. Examination of urine, that is urinalysis, is done by three processes: physical examination, microscopic examination, and chemical analysis. Physical examination. Volume. Increase in urine volume indicates increase in protein catabolism and renal disorders such as chronic renal failure, diabetes insipidus and glycosuria. Color. Normally, urine is straw colored. Abnormal colorization of urine is due to several causes such as jaundice, hematuria, medications, excess urobilinogen and ingestion of beetroot or color added to food. Appearance. Normally, urine is clear. It becomes turbid in both physiological and pathological conditions. Specific gravity. Specific gravity of urine is the measure of dissolved solution test in urine. It lows in diabetes insipidus, diabetes mellitus, acute renal failure and excessive medication. Osmolarity. Osmolarity of urine decreases in diabetes insipidus. pH and reaction. Measurement of pH is useful for determining the metabolic or respiratory acidosis or alkalosis. The pH decreases in renal disease. Microscopic examination. Microscopic examination of centrifuge sediment of urine is useful in determining the renal disease. Red blood cells. Presence of red blood cells in urine indicate glomerular disease such as glomerular nephritis. White blood cells. Normally, few white blood cells appear in high power field. The number increases in acute glomerular nephritis, infection of urinary tract and vagina or cervix. Epithelial cell. Normally, few tubular epithelial cells slug into urine. Presence of many epithelial cells suggests nephrotic syndrome and tubular necrosis. Cast. Cast are the cylindrical bodies that are molded in the shape of renal tubule. Hyaline and granular casts, which are formed by precipitation of proteins, may appear in urine in small numbers. The number increases in proteinuria due to glomerular nephritis. Red blood cells cast appear in urine during glomerular nephritis and tubular necrosis. White blood cells cast appear in pyelonephritis. Epithelial casts are formed during acute tubular necrosis. Crystals. Several types of crystals are present in normal urine. Common crystals are the crystals of calcium oxalate, calcium phosphate, uric acid and triple phosphate like calcium, ammonium and magnesium. Abnormal crystals such as crystals of cystine and triosine appear in liver disease. Bacteria. Culture studies are necessary to determine the presence of bacteria in urine. Chemical analysis. Glucose. Glucose appears in urine when the blood glucose level increases above 180 mg per dl. Glycosuria may be the first indicator of diabetes mellitus, that is, presence of glucose in urine. Protein. Presence of excessive protein, proteinuria, particularly albuminuria in urine indicate renal disease. The normal urine excretion of albumin in a healthy adult is 30 mg per day. It exceeds the level glomerulonephritis. It also increases in fever and severe exercise. Ketone bodies. Ketonuria, that is presence of ketone bodies in urine, occurs in pregnancy, fever, diabetes mellitus, prolonged starvation and glycogen storage disease. Bilirubin. Bilirubin appears in urine during hepatic and post-hepatic jaundice. Urobilinogen. Normally about 1 to 3.5 mg of urobilinogen is excreted in urine daily. Excessive urobilinogen in urine indicates hemolytic jaundice. Bile salts. Presence of bile salts in urine reveals jaundice. Blood. Presence of blood in urine, that is hematuria, indicates glomerulonephritis, renal stone, infection or malignancy of urinary tract. Hemoglobin. Hemoglobin appears in urine, hemoglobinuria, during excess hemolysis. Nitrite. Presence of nitrate in urine indicate presence of bacteria in urine, since some bacteria convert nitrate into nitrite in urine. Examination of blood. Estimation of plasma protein. Here we can see the normal values like total protein, serum albumin, serum globulin, fibrinogen. Level of plasma protein is altered during renal failure. Estimation of urea, uric acid and creatinine, like same normal values like urea, uric acid, creatinine. The blood level of these substances increases in renal failure. Examination of blood and urine. Plasma clearance. Plasma clearance is defined as amount of plasma that is cleared off of a substance in a given unit of time. It is also known as renal clearance. It is based on Fick principle. Determination of clearance value for the certain substances helps in assessing the following renal function: glomerular filtration rate, renal plasma flow, renal blood flow. Value of following factors is required to determine the plasma clearance for a particular substance, like volume of urine excreted, concentration of substance in urine, and the concentration of substance in blood. The formula to calculate the clearance value is C is equal to UV by P, where C clearance, U concentration of the substance in urine, V volume of urine flow, and P concentration of substance in plasma. Measurement of glomerular filtration rate. A substance that is completely filtered but neither reabsorbed nor secreted should be used to measure glomerular filtration rate. Insulin is the ideal substance used to measure GFR. It is completely filtered, neither reabsorbed nor secreted. So insulin clearance indicates GFR. Insulin clearance. A known amount of insulin is injected into the body. After some time, the concentration of insulin in plasma and urine and the volume of urine excreted are estimated. For example, concentration of insulin in urine is 125 mg per dl, concentration of insulin in plasma is 1 mg per dl, and the volume of urine output is 1 ml per minute. So, the glomerular filtration rate is equal to UV by P is equal to 125 into 1 by 1, that is 125 ml per minute. Creatinine clearance. Creatinine clearance is also used to measure GFR accurately. It is easier than insulin clearance because creatinine is already present in body fluids and its plasma concentration is steady throughout the day. It is completely filtered, and being a metabolite, it is neither reabsorbed nor secreted. The normal value of GFR by this method is approximately same as determined by insulin clearance. Measurement of renal plasma flow. To measure renal plasma flow, a substance which is filtered and secreted but not reabsorbed should be used. Such a substance is para-aminohippuric acid. pH clearance indicate amount of plasma passed through kidneys. A known amount of PAH is injected into the body. After some time, the concentration of pH in plasma and urine and the volume of urine excreted are estimated. For example, like concentration of pH in urine is 66 mg per dl and concentration of pH in plasma is 0.1 mg per dl. Volume urine output is 1 ml per minute. Thus, renal plasma flow is equal to UV by P. 66 into 1 divided by 0.1 is equal to 660 ml per minute. Measurement of renal blood flow. Value of factors necessary to determine renal blood flow are renal plasma flow and percentage of plasma volume in blood. Renal plasma flow. Renal plasma flow is measured by using pH clearance. Percentage of plasma volume in blood. Percentage of plasma volume is indirectly determined by using packed cell volume. For example, if packed cell volume is equal to 45%, plasma volume in blood is equal to 100 minus 45 equal to 55%. That is 55 ml of plasma is present in every 100 ml of blood. Urea clearance test. Urea is a waste product formed during protein metabolism and it is excreted in urine. So, determination of urea clearance forms a specific test to assess renal function. Urea clearance test is a clinical test to assess renal function by using clearance of urea from plasma by kidney every minute. This test requires a blood sample to determine urea level in blood and two urine samples collected at 1 hour interval to determine the urea cleared by kidney into one urine. Normal value of urea clearance is 70 ml per minute. Thank you.